I first started with symptoms at the age of 27 in 2006, but I was genetically tested at the age of 15 or 16, so I knew I had the gene for acute intermittent porphyria. When I started with symptoms at the age of 27, I started with back pain and leg pain around the time of menstruation, and this just gradually got worse over a period of months. Because my sister had the condition and because we had family awareness, I had genetic testing at the age of 16, so I knew I had the gene. All of my life I wore a medical alert bracelet, so I avoided all the trigger drugs. So the fact that I'd been screened made such a difference, and I would, if anybody has got porphyria in their family, it's so important to go and have a check. And it's very easy to get genetic testing, have your genes tested and sent to a specialist lab, and they can tell you if you have the gene or not, because if you know you've got the gene, you can then protect yourself and protect your children against it. Whereas if you don't know you have, you don't know what the dangers are, and it's so important. When I first presented, my sister phoned one of the specialists in Cardiff and contacted him directly and said, what should we do? She's in Kent, we don't know anybody down there. And he was the one who said, send me a sample, get a referral to King's, which was my nearest hospital, which was a specialist centre. So I went there, and I think had I not had that knowledge through the family, I think I would have got a lot worse. I wasn't in a good situation over a long period of time. Over a good 18 months period, my health deteriorated significantly, quite rapidly, to me being made redundant and not being able to work. And that's even with the knowledge that I had. Had I not had that knowledge, I fear that I probably would have got paralysed. I would have had a lot of other long-term issues that a lot of people with porphyria who are misdiagnosed early. It isn't just the fact that they have a horrible time at that point. They're left with long-term paralysis problems that affect them then for the rest of their life. And I feel very privileged that as much as it affects me on a daily basis now, I'm not in that position. So I'm very lucky that I was in the position I was. They couldn't see there was anything wrong with me. They didn't believe there was anything wrong with me. They didn't want to give me any pain relief. And it was only after my sister said, this is what's wrong. We have confirmation that she's having an active attack. This is the treatment that you need. It took them about 24 hours to get the treatment. And even then, once you get to the stage of being on the wards, the nurses don't know how to deal with it. They don't understand the fact that you haven't got physical pain, that they can't see it even though you're in pain. So there's a lot of problems from the nursing staff through to the doctors that come round on the wards, problems with getting the pain relief and the actual treatment for the condition. So it has affected my life, but I think it's about being positive and looking forward to build it in so that hopefully you can still have a life. When you're struck with a rare disease like this, you have to have a positive attitude, otherwise you wouldn't go and do anything. You would become a hospital patient for the rest of your life. If I'm honest, I actually get pain probably every single day. I struggle quite regularly, and this often happens with people who have an active porphyria regularly, that they kind of have attacks so regularly that they get a lot of what they class as residual pain, and it's from nerve damage pain. So I regularly get pain in my legs and in my back, and I probably suffer with pain most days. And they always give you a scale of pain, and if it's only low on the scale, I manage just fine. I don't take painkillers. If I get to a point where it's affecting my sleep, I take strong painkillers at night, and something also to help with my sickness, because when the pain gets worse, I feel sick. But the treatment that I take for the pain makes me feel more sick. So it's kind of I then have to take anti-sickness as well as the pain relief. That for anybody who has got a history of porphyria in their family, do not hesitate and get your children tested. We have family members who wouldn't get their children tested, and I think it's ignorance. You want to be able to protect, and the easiest way to protect is to know you have it. You know, a lot of people say things like identify that you've got acute intermittent porphyria or got an acute porphyria. If you don't know you have it, how are you meant to avoid the triggers? And if you avoid the triggers, you have a really good chance of living a long and healthy life without ever presenting with the symptoms.